So what I'm going to do to start with is I'm going to just do a little local anesthetic right around this bulging vein that she has. This is probably the worst part of the whole thing because the numbing burns just a little bit, but it's definitely tolerable. A lot of people are very, very, very apprehensive about this procedure. It's really not. It's just the sound of it is taking that vein out of there. Sounds awfully gruesome, but it's really not. But I guess you could ask our patient.
How are you doing, Rebecca?
I'm doing good.
Okay.
It stings a little, but it's totally tolerable.
Okay. How is this different than what people perceive as like vein stripping?
Well, vein stripping is essentially making a very long, large incision, and then they grab a hold of that vein and they just essentially pull the entire length of it out. What we're doing is we address the issues that are bulging, and we remove the parts that are bulging, because what we found is that it's basically your veins are like a hose, and when I cut a section out of that hose, it's not going to engorge and swell anymore. And so your body's going to take care of anything that's left, and then we've got rid of the stuff that's on the surface. So just by removing, you know, a small section that's sticking out, we're going to end up getting everything that's left. So we make a little tiny nick in the skin. And we have a little tool that we can grab the edge of that vein. And I just kind of get a hold of it and sort of gently work it out. You alright?
Yeah, I'm good.
People will usually feel a little bit of a tugging sensation. And they're fairly non-impressive. That's good. And then based on how much we get out, we make a little nick on the, we go that far down. And we essentially take it out section by section. Because you've really closed off initially the source of these, our hope is, of course, that once we close off the source that they decompress and we don't have to do this. But if we do have to do this, it's not uncommon and it's pretty simple and it's pretty quick. And she'll leave with a bandage on her leg for 24 hours. After 24 hours, she can take the bandage off and just put her stockings back on, and that's it.
It really does just look like a little string, doesn't it?
Yep.
That's her vein.
Fairly not impressive. Not at all what you would expect. Really quick, actually. And if at any time anybody, you know, has any discomfort or feels anything, we just give a little more numbing. That's it. If you notice she's not doing too bad, she's playing Angry Birds.
Let's see. So this is how our patient's reacting. Answering some email.
Right.
Angry Birds.
Play a little Angry Birds. So then when she's done, there's no stitches or anything because these are like very, very small incisions. We just put what's called steri strips or some little band-aids on there, and they fall off on their own. Usually takes about a week, and after that, she's good to go. There's very little scarring. The worst part about this is probably, I don't know, the bandage maybe, the first 24 hours. She can't take a shower for 24 hours. But other than that,
And wearing, how long do you have to wear the,
easy
the
cheesy lemon squeezy.
how long do you have to wear the compression stockings after this procedure?
Typically what we try to do for our patients, because no one likes wearing the compression stockings, is we will do this very quickly after the venous closure. And that way, after the venous closure, you're in the stocking for 3 weeks. Well, after the phlebectomy, you really need to wear the stockings for 2 weeks, but we try to overlap it. So essentially, you're in the stockings for the same 3 weeks. So we'll do this in week 2. You'll wear them for 2 weeks, which is at the same time of your other stocking wearing time.
Okay.
That way we can get people out of the stockings as quickly as possible. So, and that's it.